What is that? If you grab your phone, we're going to have this up on the screen for a few seconds. It'll take you to a web page that's in both English and Spanish, which will give you the context of the program in advance of a couple seconds. We'll get started here shortly. Thank you for being here.
All right, everybody, we're going to get started with our second panel of the day. Welcome to RGV Startup Week. How is everybody feeling? Really? A little bit louder. Well, thank you so much for being here. I am truly grateful that we finally are here. This is our second year. I hope you guys enjoy all the sessions and the panels and the events. Join us for the rest of the day. We are going to have tremendous panelists throughout the day. As you saw, the quality that we had on our first panel is unmatchable. But we're trying to continue to raise the bar. And we also have sessions in the back. Please take advantage of them. These are all resources for the community, for you, for entrepreneurs, for organizations, and anybody anybody that's interested in being part of this amazing week. We are here, we're not just here all week. We're here Monday and Tuesday. Then we go to McAllen and Weslaco. Weslaco has a fantastic lineup, as well as Thursday in Far and Mission. And we come back to Brownsville. So follow us throughout the Rio Grande Valley. We're so excited to be here with you. And I am going to introduce our second panel. I'm not going to say a lot about them because they have their own way of introducing themselves. But our panelists today and our panel moderators are all about social determinants of health, something that we have been working closely with our partners in this organization to make this an important topic here in the Rio Grande Valley, to make it, relevant, to make sure that you know what it is and how entrepreneurship and innovation plays a key role in it. So without further ado, our second panel, SDOH.
Wherever it is you're at in your journey would constitute a beginning, a first step. But please know that this is not the only step. One of our main challenges has been getting folks talking about social determinants of health.
There's a few other criteria.
Be realistic and be open.
You know your community. You know the issues of your community. The theme of this week is building the future. What we would ask you to do is include social determinants of health in your future thinking. Somebody in this room is going to do something that impacts lives. Welcome to RGV Startup Week! I stole somebody's mic. Okay. Man. When they told me that we were going to be following Vicente Fox, and Linda said it quite well when she basically said that it's kind of all downhill from there as it relates to folks that they could put on the stage that would be as powerful as a former president speaking to you in these times. But we'll try. What it is that we're trying to discuss is a conversation that, to Linda's point, has surrounded us since really kind of the beginning of time. And when she said that we have our own way of introducing ourselves, we certainly hope that in the future, our way looks a lot more like your way. And that being part of what it is that we're here today to do is to try to create some common language around a concept that once you really start to get familiar and educate yourself with, you'll have the light bulb moment that says, oh yeah, that's my grandmother. That's my brother. That's me. And I didn't know that I had an opportunity to make a difference. I don't want to spend too much time on context because we have three people here who are working in the space at a very high level, and I want to make sure that we have plenty of time to engage the community, both in the room and who are watching us from wherever they're watching us, because I can tell you that social determinants of health are not just an RGV issue. It's an everybody issue. But if we continue to think that it's only an issue to the underserved or to the low income or only impacts Hispanics, we're thinking about this incorrectly. If we continue to think that this is something that you have to donate your life's work to without having the ability to be rewarded for that work, you're thinking about this incorrectly. As the video said, and I'll say again, is this week is about building the future. You heard that from President Fox. We need to look to the future and work together as a united valley and certainly retain all of the things that make us unique. When we first started coming to the valley and we said, hey, this is the RGV, people would say, nah, man, I'm from Weslaco. And that needs to be retained. But the valley is the one that really needs to be working together to make sure that that is retained. Because we are neighbors. And when you look at South Texas and San Antonio and the valley being neighbors, You'll hear shortly from Dr. Lisa Ochoa about how her clinics, the demographies that she is serving, are very, very similar to the Valley. She's from here. She would know. So without further ado, I'm going to tee up the people that we have here and then kind of quickly get into some questions, and even quicker start to get into some questions with you, the community, who we were very, very fortunate to engage over the course of the last 2 or 3 days. Because again, we are here and then we go back to San Antonio. Daniel goes back to Toronto. But the work that we're doing affects you, and you have to be our champions, our voice. We're not going to get all of this right the first time. The second time, nor the fourth or sixth. You will hear throughout the course of these 8 days that just kind of comes along with it. Success and failure, effort. But what are we efforting for? And that was something that President Fox also said. It's not just the comings together, it's the purpose for which we are coming together. And what we're saying is, hey, look, if you're searching for a purpose, amen, we at least have one avenue for you to be thinking about. And there are a variety of avenues in this particular opportunity that we hope that each one of you could see yourselves in and your future opportunity in. So when you think of building the future, please think of social determinants of health in that thought process. Now, I'd be remiss if I didn't call attention to the folks who are making this happen. That being VelocityTX, which is a bioresearch accelerator campus on the east side of San Antonio, Texas. That is an industry partner that believes in this mission, coincided with Methodist Healthcare Ministries, who is a faith-based nonprofit who is serving the spiritual, mental, and physical health of the lower income and underserved communities of South Texas. But as you'll hear today, there's a lot of ways to attack those issues, and what we're focused on is this particular program. This particular program resourcing entrepreneurs, resourcing revenue-sustainable businesses, resourcing folks that you see on this panel right here. So without further ado, who are you? I will start with Dr. Lisa Ochoa as I get my place here in line. So we went through this exercise yesterday. It was kind of a cool exercise, and the exercise that was, we had the opportunity to have a much longer conversation, Lisa and I did, which we will publish later, that really kind of gets into the story of her mission and her purpose. But we went through the exercise of what does ChatGPT say about you? And here's what it came up with is Dr. Lisa Ochoa, board-certified vascular surgeon, founder of the San Antonio Vascular and Endovascular Clinic, and a true leader in driving community health innovation from inside the system. Born and raised in the Rio Grande Valley, mission to be specific, Dr. Ochoa's work tackles some of the toughest health challenges facing underserved communities. Through her clinic and community partnerships, Save Clinic, she's proving that even within traditional healthcare, you can innovate and change lives by addressing root causes. We are honored to have you here with us today. Please welcome Dr. Lisa Ochoa. Next up, please welcome on the other side, Dr. Daniel Liaquet, CEO and co-founder of Tabiat and a standout member of last year's South Texas Community Health Accelerator. He is the example. He flew in from Toronto last night, has been on a plane, has been up, has been meeting people, has been getting to know this community, is trying to figure out who it is that he needs to be connecting with. So I would tell you, please listen to this man when he says, here are the things that I'm trying to do with and for you. Thank you for being here. And then we have a friend of mine, Lena Rugova, founder of Emerge and Rise, a nonprofit venture development organization dedicated to helping entrepreneurs launch businesses that create real community change. Lena specializes in connecting founders to the tools they need, whether it's strategic planning, financial literacy, or mentorship, so that great ideas can grow into sustainable enterprises. You are a builder of future builders and a critical piece of the innovation ecosystem. Oh, by the way, is also in a PhD program for Social Determinants of Health. Thank you so much. You drove this morning to make sure you were here on time. Thank you for being here. All right, so without further ado, into questions. My first question is for the panel. Dr. Ochoa, I will start with you on the response. Since the theming of this panel is to really get us to a core and common language. By the way, Stacy, please raise your hand. Anybody who wants to have a session after this in Spanish, please. Stacy is offering her time to translate these concepts and get you connected. Thank you for that. So, Dr. Ochoa, since we are trying to create common language and plain language, let's start at that level, the ground level. When we're talking about social determinants of health, SDOH, what does that actually mean to you, and why does it matter to the work that you do?
Great question. What is social determinants of health? Well, let me start with what I do and how I came to learn about social determinants of health. So I'm a vascular surgeon. I'm a doctor. And so I see a lot of patients, and in San Antonio, when I first moved there, I worked to places north of San Antonio and south of San Antonio and saw those differences. And the specific marker that I follow are diabetes-related amputations. And the reason for that is that a diabetic amputation is completely preventable, right? And so when I first started my practice, I wanted to focus in the areas of San Antonio that had the highest rates, because I figured if I can move the needle in these specific zip codes, I can move the needle for Bexar County. And it quickly became, I realized that as a surgeon alone and medical care alone, I'm not going to be able to move that needle. And the reason for that is because over 80% of healthcare outcomes is affected by the social determinants of health. It's affected by the education that you're given in your community, the sidewalks, the access to healthy foods, it's health literacy, it's access to health care, it's access to insurance, it's clean air, tree coverage, quality of soil. And so you've heard the people say that it is your zip code that dictates your healthcare outcomes even more than the direct medical care that you get. And so that summarizes for me when I realized as a vascular surgeon, if I wanted to impact my community, that I had to do more than just surgery. And so that's where going into the social determinants of health expanded for me, and realizing we got to work at the community level. And so one of the things that we have done in San Antonio with our Southside leaders, because we saw these inequities, is we created a nonprofit called the Center for Health Equity in South Texas. And this nonprofit brings all sectors from housing, environment, education, workforce development, public health, and healthcare, every sector to work together to address the fact that lifespan varies 20 years north and south of San Antonio. And the reality is medical care and hospitals and clinics and doctors are not going to do it alone. We have to address what's in the community, the social determinants of health.
Thank you, Dr. Ochoa. Lena?
So it's a little bit different for me. I'm an immigrant to this country, and so the first thing when I came in, I noticed weight gain, right? It's a very difficult thing. You're coming from another country, you being fed different food, you think you have a healthy genes and so forth, and then you come here and then things starting spiraling out of control. So I think to me it's very important to know that health goes beyond doctor's office. I think it's very important to know that some people don't even have access to that. And social determinants of health is more than just health. It's access to financial literacy, digital literacy, technology, sustainability. So I think this is the most important thing to me.
Thank you. Yeah, so again, a slightly different perspective coming into this as a founder and a startup, but whenever you're doing, if you're going down the entrepreneurship journey, you've probably heard that what you're trying to do is solve a problem. And that's what really pushed me both towards the startup that I'm working on, is observing the problem. And then that's what later pushed me into SDOH as well. So the example of this is I started off in technology, and I'm a computer scientist by training, and I wanted to build cool technology. But I also had this thing in the back of my head is whatever I'm building, I want it to be impactful and actually help people. So I started looking into the healthcare space and how I can combine technology and healthcare. Came across this disease called COPD, which is the third leading cause of death worldwide, and has a huge problem with readmissions. So started looking, like, people are discharged from hospital and they end up back in the hospital. About 25% of them will end up back in the hospital in 30 days. So started looking into that and understanding what leads to those readmissions. And one of the big predictors is actually whether or not the patient goes to a follow-up specialist appointment. And if you start looking into why they're not going into those appointments, oftentimes they don't have funds to get to that appointment. They don't have transportation. So this following of these problems led me to understanding some of this a little bit better. But to generalize that back a little bit, what you're really trying to do is make an impact, solve a problem. And when, as Dr. Ochoa mentioned, over 80% of health outcomes are defined by these types of elements, it is natural and sort of, no matter what road you chase down, you're going to end up at this point where you need to be aware of what these social determinants of health are and how they impact the problem that you're trying to solve, because you're ultimately going to get there and you need to be able to deal with it.
You know, as we were talking at dinner yesterday, you guys had a moment where, as you were talking about what it is that you're building, there was a little bit of a moment where you're like, man, I need that, or that would help my practice. Whereas earlier in the day, when we were talking about potential innovation in your space, you had mentioned there's just a lot of people that are trying to pitch you, for lack of a better term, without the relationship building, without the awareness of the tech, if you will. But you guys having the opportunity to have had a face-to-face conversation and saying, hey, what you're doing may have an impact in my industry, that being a very good example of what you said, hey, I'm approaching this from a different angle, I'm approaching this from a different angle, and that really being the opportunity base here being kind of a far and wide. While we're on the topic of business, though, because that's what the Community Health Accelerator is really intended to do, is to create revenue sustainable businesses, we had this conversation, Lisa, you and I did yesterday, about kind of the hows. And to start to demystify the thought process that if you're going to work in healthcare, you have to either sacrifice your time and effort and life and just not get rewarded for that, or you have to be in a nonprofit, donation, policy-driven environment versus just kind of tried and true, I have a pro forma, this is a business. How have you been able to do that in your environment?
So I am one of the 22% of vascular surgeons in the country that still have my own independent private practice. The majority of vascular surgeons are employed by hospitals or venture capitalist groups and everything else that control them. It's not been easy, but what was important to me and why I started my own practice was because I wanted to practice medicine and vascular surgery the way I was trained to. And so how did I do that? I mean, as a business, so I got a loan. That's what I did. I took out a loan of my own. I had been practicing in the city of San Antonio already for 6 years, so I already had a referral base. And I had my partner and a business administrator give me numbers of what would it look like to start my own practice. And he gave me like the financial numbers. I'm like, no, I want to know the numbers. How many patients do I have to see? How many procedures do I have to do? How many surgeries do I have to do? So I started with those numbers and I looked at them like, oh, that's easy. That I got, I can do. So that's what kind of led me to jump into, yes, we can do this. But we started like rolling our sleeves up, like everybody says, and doing the work. I went door to door to meet every primary care doctor, every wound care doctor, every nephrologist, every cardiologist to tell them, I'm starting my own practice, you have my cell phone number, and I'm gonna partner with you to take care of your patients. So it's about relationships. You know, I can't just say, oh, put up my sign, send me all your patients. You have to build that relationship. For me, it's referring physicians and then with the patients themselves. And so when I also started my practice, it was very important to me, like I said, that I practice quality medicine, evidence-based medicine, which in the healthcare space doesn't always happen. Sometimes it's very profit-driven, and I vowed that I was going to hold to my values, that I was not going to do that I was going to do just what the patient needed and nothing more. But I did recognize that that margin was going to be smaller than where I know other groups in other areas would be. And so we just planned for that. I knew that I had to see a higher volume. I knew I had to create a cost-efficient practice. I knew that I had to create a place that was very, very efficient. And we did many things. Like, I'll give you one example. When we opened our surgery center, we actually, you know, you've seen those tables that we set up all our instruments that the surgeons do. You've seen it in the movies, right? Well, if you do an operating room table, it's like thousands of dollars. If you buy a chef's stainless steel table, it's a few $100s. You know? And so there's some things like that, or we went to some auctions when hospitals shut down. They sell everything in the hospital, from the stretchers to the lights in the operating room. And so there are things that we saved money on, and we did the work to buy that efficiently. At the same time, not compromising on the things that were quality that I had to have to do my job. And so there are certain devices and certain instruments that I will not cut cuss on, because that's the quality of what we deliver. It's been challenging, but the way you do it is you have to work the business. I have to be financially viable to serve my mission of serving these underserved communities. And so you have to look at both ends if you're going to be able to deliver quality health care. But it is possible, and that's my message is for physicians, is that you can be financially viable and practice an evidence-based medicine, really have an impact in your community, and still have that reward.
So, Dan, you're in a very similar space and time in the respect that you're the one that's actually trying to pitch. When we were talking yesterday, you are now at a point where you have a product that is ready to be pitched, sold, used. What are some of the conversations that you're having on the other side, like on the doctor's side, that if you had their attention right now, because we do have the attention of people, what is it that you're trying to tell them as it relates to what Tabiat's doing to improve their environment and SDOH narrative?
That's a great question. Actually, it ties back to what President Fox said this morning, where we're essentially neighbors in an ecosystem, and we can't just, my product is not a stick that I'm just going to be like, here, this is a product, like, you have to use it. I can't pitch in that way. It's really about being neighbors and understanding sort of what is the problem that the person on the other side of the table is trying to solve, and where do I fit into that piece as well. So that's probably, and from a entrepreneurship perspective, probably one of the biggest mistakes you could do as a founder on a sales call is pitch your product too early. You're trying to understand what the other person needs. So from that context, that's something that we had to learn as well, because I was pitching Tabiat off the bat too early. But the more I listen to what it is the other person on the table wants, so when I talk to hospitals, I have to understand what it is that they care about. Hospitals care about readmission rates. They care about being able to provide high quality care to patients, but they're financially constrained just like everyone else. So they have to do so in a way that it makes financial sense for them. And then I have to design my solution around that. So here's the program that we built together. This is how we improve patient care. This is the services that we're going to offer, and these are the financials that go along with it, because ultimately they do care about, you know, the number of patients that they see, the number of people that they help, and the fact that they're going to be able to do this long-term sustainably. So where do we fit in, and how do we provide all these services to the hospital? It's an evolving process. You have to keep that in mind as you're having these conversations and improving your product.
Thank you. So being part of a support system like MHM Accelerator and or Emerge and Rise, Lena, I want to talk to you. There was something that I saw come out from your organization the other day, which, by the way, just had a grand opening in a physical space, right? Like, you've been at this for multiple years, but just recently opened a physical support space. Certainly use this as an opportunity to talk about that. But the thing that I saw and pulled from that says, today, a conversation that quietly spanned continents and also bridged sectors reminded us that real impact happens behind closed doors. Leadership, diplomacy, and community building walked into the same room, and no one needed a press badge to know something meaningful is in motion. For me, that kind of speaks to the question that I'm getting ready to ask you, is whether it's Daniel, part of an MHM Accelerator support system, somebody attached to Emerge and Rise, SAVE Clinic, or Center for Health Equity South Texas, it plays a role. Can you speak to what happens when that focus of power, time, and resources are directed towards a clear outcome, one like the social determinants of health?
Yeah, I think one of the things when we opened, so we started Emerge and Rise in 2021. This was right after the pandemic. I moved from New York City to San Antonio. Pandemic happens. We didn't know what to do. Prior to that, I spent actually maybe 15 years in healthcare. So I was in healthcare, then I went into healthcare consulting before I went to the startup world. So I moved to San Antonio, new city. We didn't know anyone. We didn't have any family. So we thought, okay, what is it that I can do? I can do consulting as I did in New York City. It's a different environment. So I said, let me immerse into this whole city, get to know everybody. And so as you're learning, so for the past 5 years, I've been learning about our city. San Antonio is big. Lots of opportunities. There's a lot of work, just like any other city, right? It's not different from anything else. It is just the way you approach it. So I think one of the things that I decided to do, Christine is sitting on the back, she's our VP when I brought her in, when she used to be with Capital Factor. I said, one of the things I want to do is do a lot of one-on-ones. I think that's what's working for us. This is what's different for us. We meet with a lot of people one-on-one. We listen. I think the biggest thing that's missing anywhere is active listening and this transparency, where I can sit and try to pick up on what it is that I can do, right? I hate gatekeeping. We see that a lot in everywhere in other ecosystems, and this is important to me because this is where we can sit down and make a plan, and not just make a plan, but make an action. And one of the things that I'm picking up from all of this is relationship building is important. And so if you're trying to build a company, it could be for-profit, it could be nonprofit, although we always say don't go the nonprofit route. There's a way to make money out of it, but if you're making a company, it has to be mission aligned. So you can make money and still do good at the same time, and use all the resources available. In San Antonio, we have a lot of amazing resources. Any company you want to start, you could go to any place and there will be mentors. There will be, any financial situation you may be having. And one of the aspects of Emerging Rise is the financial literacy, because I think that's a huge barrier for people, not just in low income, but a lot of women, veterans, in transition, a lot of people who are, especially in the federal level, everything that's happening, that they need to be looking for a new position possibly. So I think we need to think about these things a little bit more in a bigger picture. What could be affecting someone not getting to that next thing, and trying to find those solutions within whatever it is that we're trying to implement, or those companies, those ideas that we're having.
So, San Antonio is a big city. Despite us being labeled a big city in a small town, quite honestly, we're a big city in a big town. We've kind of crossed that. And the RGV is in a very similar moment in time. You are also quite big. 1.3 million people. The MHM coverage network is 74 counties. We got Starr, Hidalgo, Cameron, Willacy, and many, many, many more. But in that population, 1 in 3 families are living below the federal poverty line. 30% of Brownsville residents where we sit today live below the federal poverty line. Harlingen, where we were at Friday, Saturday, and Sunday for Startup Boot Camp, consistently ranking amongst the lowest in physician-to-patient ratios nationally. 1 doctor for 2,000 plus residents on average. Hidalgo County, Dr. Ochoa, where you're from, nearly 30% of those residents are uninsured, highest rate in Texas and nearly double the national average. Now look, I don't need to tell you your issues. The video at the very beginning said, you know your issues. What we're trying to do is provide resourcing for those issues, those known issues, and provide not just, hey, we're here and we've brought some really great people who have donated their time and tried to connect in, but really provide you with something that would stay with you. Programs, relationships, connections, pathways to funding and pilot programs. But what you will hear over and over and over again, whether it's from President Fox, Dr. Ochoa, or from whoever has your back, at some point in time, you have got to roll up your sleeves and do the work. Part of us doing the work was being out and about in Brownsville this weekend and just kind of meeting some folks. And you never know when these chance encounters are going to occur. But we were fortunate enough to meet some community leaders who were driving innovation in SDOH. And it was just kind of a very serendipitous moment. And we were able to invite them to a dinner that, when we were putting it together, it obviously didn't include them in our thought process by name, but it included them by way of why we were doing it. And all of a sudden you appeared. My group from Frontera Leadership Institute, from Elements, from DiaBuddy, from Community Catalyst. I don't think, and Doug, I'd be remiss without mentioning Doug Best, who, again, we've been down here now for 6 months. And there have been people who have shown up for us just as much as we're trying to show up for you. So, without further ado, I want to turn it over to the folks that we connected to so you could ask questions to help better localize this conversation. You have the time and attention of this panel. So, Victoria and Rebecca from DiaBuddy, I am coming to you first.
Thank you. So I am Rebecca from DiaBuddy, a diabetes management app. And so my question is, when building solutions that address health disparities, what advice would you give for gaining trust in communities like Brownsville?
I'm going to direct that one to Dr. Liaquet, since he was part of our cohort last year. Let's try to keep responses to, let's just say, 2 minutes so we can have as much participation as we can. Thank you, sir. Go.
That's also a great question. I think part of what goes into it is identifying personas. Like, that's an activity you'll often see as part of startup courses and boot camps, but it is also a really important piece. And you want to really drill down and figure out who are the personas, who are the people that you're trying to help. And that will include patients. It's if you have people who have diabetes as part of your platform, you need to be able to identify what that person looks like. If it's hospitals that you're working with, if it's doctors, if it's other community partners, figure out who are all those partners in your community that will be involved in this endeavor, and then figure out where they are. So that's going to vary. You have resources here, some of the programs, some of the accelerators, and especially MHM's Social Determinants of Health Community Accelerator. That's what it gave us access to, is these are players in this ecosystem that are interested in solving this particular problem. So you want to identify those people, figure out where they are, and go talk to them to figure out how you can serve them in a way that's going to be beneficial both to you and to those partners.
You know, we've mentioned the Community Health Accelerator a few times. At the beginning of this panel, we had discussed the QR code being here. So if you've not had a chance to scan that, if you could please, that will bring up the page that is in both English and Spanish, and will lead you to these resources, whether that's videos of speaker seminar series that have occurred, future appointments, ways to connect, but certainly an application to that Health Accelerator. We are active now. We are soliciting applications into this program. The carrot at the end of that stick being a pilot through MHM's network, which is a big deal. Okay, so does anybody have a question for Dr. Ochoa? Right here. Karina, Frontera Leadership Institute.
Hello. I also work at a doctor's office. And my question was, how could you have staff look for social determinants of health without overwhelming the workflow for a private practice?
Great question. And so in a private practice, we're still a business, and how do I get my staff who are already doing so much, right, to address social determinants of health? And the process is, one, slowly, and two, I needed help. And so I was fortunate that in San Antonio, we have an organization called Health Confianza that really brought in, or different organizations, not just doctors' offices, to teach the staff, everyone from my front desk, my medical assistants, to the people who answer my phone, on how to recognize social determinants of health. And one simple thing is language. Right, so is the fact that, you know, a lot of my population speaks Spanish, so having Spanish speakers on the other end, I know it sounds simple, but to understand them is very important. The other part is health literacy. I mean, I will say things like peripheral arterial disease and, coronary artery disease, and most of my patients have no idea. And so I will find that my staff mimic what I say. So part of it was also leading by example and being able to bring that language down to the layperson and using an everyday language with my staff and teaching them that that's important. The other part really is just training our staff that we are here to serve the patient. And we are here to show them kindness. We are here to take care of them, to solve problems for them, and like many people have said before, to show them love. And so part of that leads from the top, giving them the resources to learn what it has. And what I tell them is it's not like we just teach them or train them and then that's it. This is ongoing communication, ongoing training, and then getting my staff to interact with each other so that they can complement evaluating those patients. And so I literally have a front desk that will tell me, oh, this patient has trouble with transportation, so we have to call our Uber for them. And then they'll talk to my ultrasound tech, and they're like, oh, this patient smokes. I've already given him the talk about smoking cessation. And so most of my staff can have these conversations that I've heard me have with patients as well to help improve that health literacy. And when you bring it into a culture, then it's second nature. It's not added work.
You talked about common language, and that's kind of been the theme of the panel, and certainly of this last weekend, is speaking the same language. And that not just being Spanish and English, but even the words that we're using to try to connect these resources, leadership, forward motion, right, is if we're not saying the same thing. So, as a reminder, if you want to have conversation about this, and this is absolutely what we want you to do. Stacy will be available after this panel to discuss how it is that we can connect you to resources, but then also to the resources that we've already translated. We need to hear from you. You are the first people who are seeing these resources to say, hey, look, I know what you're trying to say, but this is how you should really say it. Yes, we're trying to set a stage and a tone and a tempo and provide resources, but again, this has got to be you, from you. It's for you, it needs to be from you, okay? Christine, I saw your hand up. Ladies and gentlemen, Christine Colburn from Emerge and Rise.
All right, this is for each one of you. How can cross-partnerships, well, let me rephrase that. How can cross-sector partnerships between businesses, nonprofits, and healthcare professionals accelerate, delivering solutions to the community in SDOH?
And although that was pointed to all of you, Lena, I'm going to you first on that.
I think the biggest thing for me, we need to stop with me, and start with we. I think collaboration and partnership go a long way, and I think we need to find a mutual language. At the end of the day, we all have the same objective. For us, it's making our city better, right? And for all of us, it's making our healthcare better. As we know, healthcare is not in perfect condition. So it's finding ways, like Dr. Ocho's practice is doing, and meeting those patients halfway, meeting our community halfway, educating them about different aspects of health or social determinants of health, and providing the literacy that's needed between all of the organizations.
Yeah, I would agree. And I would also add a shameless plug following on a previous question of how can we actually implement some of this. So what Dr. Ochoa mentioned is internally there's a lot of things that there needs to be a lot of awareness, which I think community programs are amazing for. And sort of, I really like these t-shirts where on the back it says, it starts with awareness, right? So awareness drives innovation. So once you have that in your community, you have the awareness to actually go and implement those processes. That's where also innovation and sort of startups come in as well. So part of what we offer is a program to help track and manage that social determinants of health information. So the community really brings together, these are problems, these are people that are trying to solve it, these are startups that are trying to innovate and help deliver solutions. And then the community and the awareness all sort of pieces that in together and helps drive everyone forward.
Yeah, so how do we all work together to solve problems? I'll be honest, if we don't work together, we're not. I mean, I've learned pretty quickly that as a doctor alone, I am not going to be able to change healthcare outcomes alone. And so I'm excited when I meet people like Lena and like Daniel, because we want the same things. And the reality is I'm already thinking of ideas like, Daniel, I need your help in tech and AI to help me solve these problems that I have in my office. Or Lena, I have, some people have some ideas. Can we help them get off the ground? How do we work together? And so not being redundant in what we're trying to do, and let them be experts in what they're in, and I want to be expert when I'm in, and then let's make sure we speak that same language. And in my world, we have translational science, things from the bench, basic science on the bench, and how does it really translate to how we treat patients, and that's very complicated, but that's similar here in how tech and how nonprofits and how we can all work together to ultimately affect not a person, but an entire community. And so I think it's places like this that brings us together. I'm going to tell you, this is the first time I've been at a startup week or an innovation place where everyone around me is in business and entrepreneurship. This is not my comfort zone. It's not where I've been before. But this is what needs to happen for us to start talking together and solving these problems.
So we are at the end of our time. Will you be around for a little bit after the panel for people that may want to talk to you afterwards, the three of you? Thank you very much. Again, Stacy will be here for Spanish translation. Please scan the QR code. Here's what I will say to end this panel is, you heard it this morning from President Fox. If you do not look to the future, you'll never get there. And if you don't know where you're going, somebody else will tell you. I will tell you that at the Healthier Tomorrow Summit, which was 2 weeks ago, it was kind of said a little bit shorter that if you're not in the kitchen, you're on the menu. Okay? So let the leadership that we've been gifted with, let the resiliency that resides in us all help us do the work that needs to be done. As Dr. Anocha and I were talking yesterday about just the resilience of the Hispanic spirit and us being able to do anything that you ask us to do, well, why can't we do this? It might be as simple as we just haven't asked you to do it. That's the ask. As you think about building the future, think about social determinants of health. It affects us all. My sincerest appreciation to RGV Startup Week, the organizers, eBridge, Brownsville Community Improvement Corporation, Velocity Texas, Methodist Healthcare Ministries, and the three people who are on this stage. Thank you so much for sharing your time. ¿Qué es SDOH?
Wait, don't go. Please don't go. We still have a lot of things going on right now, but first of all, I want to thank our panelists, Lena, Lisa, and Daniel, and our amazing host, Marcos. Thank you so much for being here. I know it's really sad that